What does it mean if you bleed during your pregnancy? Is bleeding during pregnancy dangerous? Does it necessarily mean a miscarriage? When to see a doctor? If you have these questions, we have the answer for all of them. Stick around till the end to get all the answers you need. About 15 to 25 pregnancy out of every 100 experience bleeding during their first pregnancy. A week or two after conception, when the fertilized egg implants in the lining of the uterus, light bleeding or spotting may happen. Because more blood vessels are growing in this region, the cervix may bleed more frequently during pregnancy. You may also experience spotting or light bleeding after a Pap test, a sexual activity, or a pelvic exam. So, is this necessarily a sign of trouble? Bleeding during pregnancies can have a variety of causes. Some are lighthearted, while others are serious. Both early and late in pregnancy, bleeding can happen. Earlier in pregnancy, bleeding is frequent. In many cases, it doesn't indicate a serious issue. The severity of bleeding later on during your pregnancy can vary. If you experience any bleeding while pregnant, consult your gynecologist immediately. So, what are the conditions that can result in bleeding later on? Common issues like cervix irritation or growths might result in minor bleeding. If you experience heavy bleeding, this can be a more alarming symptom. A placenta tissue could also be the root of heavy bleeding. Any bleeding further along may be a symptom of premature labor. Go to the hospital or immediately call your physicist if you experience any bleeding at the end of your pregnancy. Now, let's get on to the treatments. If you experience this in the early stage of your pregnancy, the bleeding could just be minimal and end in 1 or 2 days. Many women have a perfectly healthy delivery even after experiencing such bleeding. However, occasionally the bleeding intensifies and miscarriage is more likely to occur. In such cases, even if you contact your doctor immediately, miscarriages may occur. Some of the tissues during pregnancy may occasionally stay inside the uterus after a miscarriage. If not addressed, this might cause significant bleeding. If you require more medical attention, your doctor will let you know right away. And finally, the foremost thing is to keep your cool and not to panic, because pregnancy is a complex procedure, and during this process your body may experience a few abnormalities. I hope this video cleared some of your issues and confusions about why this occurs and what course of action should be taken. Make sure you drop a like if you find the video useful, and don't forget to subscribe to our channel. Also remember to share your experience or of someone you know in the comment section below, and I will see you again in the next one.